cancer is often labeled a silent killer because too few people are getting screened. But if you recognize the signs and catch it early, you can significantly increase your chances of survival.
Yeah, Dr. Jerry Curatola is a world-renowned dentist and founder of Rejuvenation Dentistry. He joins us now to talk about the importance of early detection. Thanks so much for being with us.
Yeah, thank you for having me. And, you know, oral cancer kills one American every day, every year. And it's among one of the top 3 largest cancers, and it's often not talked about. And, you know, when Michael Douglas got oral cancer, and he got it from the new leading cause, which is HPV virus, it made national news and people thought about it. So thank you both for bringing this to light. But I have 2 words about oral cancer, and these are really important for everyone watching to bring to their dentist. Early detection. You have a 50-50 chance of survival when it's detected by the natural eye, but with these early detection devices, such as this one, a dentist can find it and you have over a 90% chance of survival.
Okay, so doctor, just begin, what exactly is oral cancer and where can you find it in the mouth?
Yes, oral cancer is a group of cancers that are in the mouth, on the side of your cheek, under your tongue, in the back of your throat, called the oropharynx. That's where the back of your mouth toward your throat. On your palate, it could be a red patch with a white area around it. Could be a lump under your tongue that you can't move. Or it could even be difficulty swallowing.
Yeah, most of the time, and correct me if I'm wrong, but most of the time, most people aren't looking for this. It's not something where you sit in the mirror and you lift up your tongue. Dentists will sometimes ask you, hey, do you want me to do a screening for this? I've had some, they'll lift up your tongue and they'll peek back there.
They shouldn't even ask. They should just do it.
Yeah.
And I think every dentist should be mandated. This is called BellScope.
Okay.
And it's a nominal cost compared to other dental equipment, and every dentist should have one of these or the Identify 3000.
What's it do though? What is that thing? What is it?
Yeah, you'll see. See how it's glowing on my hand? It's almost like an infrared or an ultraviolet light. It's in a spectrum of light that causes photoluminescence, so it makes an abnormal cell appear without it being visible to the naked eye.
All right, now what are some of the causes and risk factors of oral cancer?
So the oldest risk factors were alcohol and tobacco, drinkers and smokers and all that. Since 2010, the #1 risk factor, and probably because we're looking for it, is HPV virus. HPV accounts for 70% of oral cancers now, and human papillomavirus. So, and that, by the way, can be transmitted sexually. So it's something to definitely be aware of and minimize your risk and exposure.
Yeah. And the thing about HPV, I mean, so many people have it, they don't realize they have it, and
Yes.
and they can transmit it, and it can cause. I mean, it is a cancer causer. Bottom line.
Right. Absolutely. So everyone should know if they have it or not, and then really understand accordingly what the risk factors are.
Okay, so what are some of the signs that you should be on the lookout for? I mean, we're not checking our mouths every day, but should we? Or
Yes,
obviously we should
you
ask
should.
the doctor to check the next time we go to the dentist. So what are some of the early signs that people can spot on their own?
A very, very common spot is the side of the tongue. If you look to the tongue and you have an ulcer, a red patch with white around it, the side of your cheek, and very commonly under the tongue. So lift your tongue up and look underneath there. Look at your palate. Are there any sores or bumps that haven't healed in a long time? You should have that looked and examined by a dentist.
Interesting. And that machine you have there, I'm just curious because what you were describing is that when you point that thing in the mouth, abnormal cells will kind of glow a little bit, right? Like that.
Exactly.
So can that be used elsewhere too? I mean, can we just scan all over the place with that thing? I don't know. I'm just wondering. I mean, this is designed for the mouth, and there's actually another lens in there. It's like a green lens. Yeah.
And that green lens helps to see, because one of the things about cancer is it needs blood to live. So it gets like a spidery vasculature. And you can see that with this. You can't see that with the naked eye.
All right. Well, Dr. Jerry Curatola, thank you so much for joining us today. This has been really informative.
Yeah.
Yeah. Thank you so much.
My pleasure.
All right. And for
You're
more
welcome.
information on oral care tips, you can follow the doctor or his dental network on Instagram. The handle are right there on your screen. Take it down.